Selamat sore dan salam sejahtera bagi kita semua. Bapak, Ibu, dan rekan-rekan sekalian, terlebih dahulu kami atas nama penyelenggara mengucapkan selamat datang dalam acara webinar Program Perlindungan Sosial di Masa Covid-19, apa yang dapat dipelajari dari bukti yang ada. Pada hari ini, Selasa 22 September 2020. Kami ingin mengucapkan terima kasih yang sebesar-besarnya kepada Bapak dan Ibu yang sudah bergabung dalam webinar hari ini. Webinar hari ini dipersembahkan oleh The Abdul Latif Jamil Poverty Action Lab atau JPAL Asia Tenggara di bawah naungan Lembaga Penyelidikan Ekonomi dan Masyarakat atau LPEM FEBUI dan dengan dukungan dari Department of Foreign Affairs and Trade Pemerintah Australia. Selain itu, kami juga mengucapkan selamat datang dan terima kasih yang sebesar-besarnya kepada yang terhormat Bapak Febrio Kacaribu PhD selaku Kepala Badan Kebijakan Fiscal Kementerian Keuangan Republik Indonesia, yang terhormat Ibu Kirsten Bishop selaku Minister Counsellor of Governance and HumanDevelopment Branch Kedutaan Besar Australia di Jakarta, yang terhormat Bapak Dr. Elan Satriawan selaku Kepala Kelompok Kerja Kebijakan Tim Nasional Percepatan Penanggulangan Kemiskinan atau TNP2K, yang terhormat Bapak Profesor Benjamin Olken, Profesor dari MIT dan merupakan Direktur Ilmiah JPAL Asia Tenggara serta peneliti terafiliasi JPAL, yang terhormat Ibu Profesor Rema Hanna, Profesor dari Harvard Kennedy School of Government dan merupakan Direktur Ilmiah JPAL Asia Tenggara serta peneliti terafiliasi JPAL, yang terhormat Ibu Lina Marliani selaku Direktur Eksekutif dari JPAL Asia Tenggara. Selanjutnya, untuk membuka webinar pada hari ini, kami mempersilahkan Ibu Lina Marliani, Direktur Eksekutif JPAL Asia Tenggara untuk memberikan kata sambutan kepada hadirin. Kepada Ibu Lina Marliani, waktu dan tempat kami persilahkan.
Terima kasih Nadia. Selamat sore Bapak Ibu sekalian dan salam sejahtera untuk kita semua. Yang saya hormati Bapak Febrio Kacaribu, Ibu Kirsten Bishop, Bapak Elan Satriawan, Ben Olken, dan Ibu Rema Hanna, dan para tamu undangan sekalian. Selamat datang dalam acara webinar kami, Program Perlindungan Sosial di Masa Covid-19, apa yang dapat dipelajari dari bukti yang ada. Perkenalkan, nama saya Lina Marliani dan saya adalah Direktur Eksekutif dari JPAL Southeast Asia. Para hadirin yang saya hormati, seperti kita ketahui, krisis COVID-19 telah mengguncang perekonomian dengan dampak terhadap lonjakan kemiskinan di berbagai negara, termasuk Indonesia. Bappenas memprediksi angka kemiskinan akan meningkat menjadi 10,63% dari sebelumnya 9,22% pada September 2019. Hal ini tentunya akan mempengaruhi pencapaian Indonesia yang telah berhasil menurunkan angka kemiskinan menjadi level 1 digit pada tahun 2018 hingga 2019. Sebuah pencapaian yang dibangun dengan komitmen tinggi dari pemerintah Indonesia selama beberapa dekade terakhir. Untuk segera mengendalikan krisis ekonomi yang diakibatkan oleh COVID-19, pemerintah Indonesia telah memprioritaskan perhatian dan sumber daya yang dimiliki untuk meningkatkan program perlindungan sosial dan stimulus ekonomi demi melindungi masyarakat miskin dan rentan, serta membantu para pelaku ekonomi. Para hadirin sekalian, webinar yang kami selenggarakan hari ini bertujuan untuk terus mendukung langkah yang telah dilakukan oleh pemerintah Indonesia dalam memitigasi dampak COVID-19, terutama dalam memperkuat program perlindungan sosial. Selama 1 jam ke depan, 1,5 jam ke depan, para narasumber yang hadir dalam acara webinar hari ini akan berbagi pengalaman dan pembelajaran mengenai strategi dan memperkuat program perlindungan sosial di masa pandemi. Sebelumnya, saya ingin mengucapkan terima kasih kepada seluruh pembicara dan moderator untuk partisipasi dan kontribusinya dalam acara hari ini. Dan kepada Kedutaan Besar Australia, Jakarta atas dukungannya dalam penyelenggaraan acara pada hari ini. Dan saya juga ingin mengucapkan rasa terima kasih kepada seluruh hadirin yang telah menyempatkan waktu untuk berpartisipasi dalam diskusi ini. Kami berharap dialog yang terbangun selama webinar ini akan memberikan pembelajaran baru yang dapat membantu menentukan langkah yang lebih baik dalam menanggapi COVID-19, terutama dalam memperkuat program perlindungan sosial sebagai jaring pengaman sosial bagi masyarakat rentan. Sekali lagi, terima kasih banyak dan selamat berdiskusi.
Terima kasih banyak Ibu Lina atas sambutannya. Selanjutnya, kami persilahkan Ibu Kirsten Bishop selaku Minister Counsellor of Governance and Human Development Branch Kedutaan Besar Australia untuk memberikan sambutan. Ibu Kirsten Bishop, we would like to welcome you to kindly give the welcoming remarks for this webinar.
Terima kasih dan selamat sore. Yang terhormat Bapak Febrio Kacaribu, Kepala Badan Kebijakan Fiscal Kementerian Keuangan, Ibu Lina Marliani, Executive Director JPAL Asia Tenggara, Bapak Benjamin Olken, Scientific Director, dan Ibu Rema Hanna, Co-Scientific Director JPAL Asia Tenggara, Bapak Elan Satriawan, Ketua Pokja Kebijakan Tim Nasional Percepatan Penanggulangan Kemiskinan atau TMP2K, serta seluruh peserta acara pada hari ini dari pemerintah pusat dan daerah, akademisi, dan lembaga swadaya masyarakat. Salam sehat dan sejahtera untuk kita semua. Saya sangat senang dapat menyambut para pembicara dan peserta yang terhormat pada sesi webinar hari ini tentang program perlindungan sosial di masa Covid-19, apa yang dapat dipelajari dari bukti yang ada. Program perlindungan sosial telah terbukti menjadi strategi utama pemerintah di seluruh dunia dalam menanggapi dampak ekonomi Covid-19, termasuk di Indonesia. Webinar hari ini adalah saat yang tepat untuk mendiskusikan tantangan dan solusi potensial dalam merancang dan mengimplementasikan kebijakan dan program perlindungan sosial yang sangat penting ini. Pandemi Covid-19 adalah tantangan terbesar saat ini yang kita hadapi bersama di seluruh dunia. Pandemi ini telah menyebabkan dampak ekonomi yang luar biasa terhadap kemiskinan global yang melanda berbagai negara. Pandemi ini juga menyebabkan ketidaksetaraan yang sudah ada sebelumnya, semakin dalam dan semakin rentan, termasuk bagi perempuan, anak-anak, orang tua lansia, dan penyandang disabilitas. Penurunan persentase kemiskinan menjadi 1 digit merupakan salah satu capaian terbesar seperti tadi Bu Lina sampaikan, pemerintah Indonesia di tahun 2018, dan pemerintah mampu mempertahankan kondisi tersebut hingga tahun 2019 sebagai hasil dari program perlindungan sosial dan kombinasi kebijakan fiskal lainnya. Namun, pandemi saat ini mempengaruhi keberhasilan pemerintah Indonesia yang telah dicapai selama 1 dekada terakhir untuk mempertahankan tingkat kemiskinan di bawah 10%. Seperti tadi Bu Lina sampaikan, Bappenas sudah memperkirakan tingkat kemiskinan dapat mencapai 10,2% atau 27,5 juta orang di tahun 2020 akibat pandemi ini. Bappenas baru-baru ini juga menyatakan bahwa hampir 13 juta orang di Indonesia dapat kehilangan pekerjaan pada tahun 2021 karena pandemi. Sebuah program perlindungan sosial yang efektif tentunya dapat menghambat laju peningkatan kemiskinan secara signifikan dan melindungi masyarakat yang paling rentan. Pemerintah Indonesia telah melakukan berbagai langkah untuk mengatasi dampak ekonomi dari pandemi. Di bawah kerangka pemulihan ekonomi nasional, pemerintah Indonesia telah mengalokasikan lebih dari 200 triliun rupiah untuk meningkatkan program perlindungan sosial. Sejak awal pandemi, pemerintah telah memperluas program-program utama perlindungan sosial yang sudah berjalan seperti program Keluarga Harapan dan program Sembako. Dan beberapa skema baru telah diluncurkan seperti bantuan langsung tunai, bantuan subsidi listrik, kartu prakerja, bantuan upah untuk pekerja, dan bantuan tunai dana desa. Terlepas dari berbagai langkah yang telah dilakukan, masih ada tantangan yang harus dihadapi, yaitu rendahnya jumlah kelompok rentan termasuk orang tua lansia dan penyandang disabilitas yang dapat dijangkau, dan Indonesia saat ini tidak memiliki asuransi untuk pengangguran. Menyalurkan bantuan tunai untuk penerima manfaat yang baru merupakan tantangan bagi setiap pemerintah dan bagi Indonesia. Tantangan yang cukup signifikan adalah masalah keterlambatan dalam penyalurannya dan masalah dalam pengelolaan data yang dapat diakses oleh pemerintah dan masyarakat. Covid-19 telah membangun komitmen yang lebih kuat bagi pemerintah Indonesia untuk melanjutkan reformasi sistem perlindungan sosial, termasuk penguatan basis data nasional atau data terpadu kesejahteraan sosial. Australia berkomitmen untuk bekerja sama dengan Indonesia dalam mengatasi dampak Covid-19. Kebijakan pembangunan yang baru di pemerintah Australia, Kemitraan untuk Pemulihan, akan fokus pada 3 hal penting untuk mengatasi tantangan COVID-19 bersama dengan mitra pemerintah, yaitu keamanan kesehatan, stabilitas, dan pemulihan ekonomi. Implementasi dari strategi tersebut akan berdasarkan pada perlindungan masyarakat yang sangat rentan, termasuk perempuan dan anak perempuan, penyandang disabilitas, anak-anak, komunitas pengungsian, orang tua, atau kelompok rentan lainnya. Dalam konteks ini, program perlindungan sosial menjadi sangat penting karena kelompok rentan cenderung merasakan dampak yang lebih berat akibat pandemi ini. Pemerintah Australia telah mendukung evolusi sistem perlindungan sosial di Indonesia selama 1 dekade. Dan kami akan terus mendukung pemerintah Indonesia untuk lebih mengembangkan dan meningkatkan jaring pengaman sosial sebagai pilar utama pemulihan ekonomi Indonesia dalam mengatasi dampak COVID-19. Kami melakukan ini melalui program perlindungan sosial mahkota serta melalui kegiatan beberapa program kemitraan pemerintah Australia dan Indonesia lainnya. Mahkota bermitra dengan TMP2K yang menjadi bagian dari kantor Wakil Presiden untuk memberikan masukan kebijakan guna mendukung agenda reformasi pemerintah. Compact, program desentralisasi kami membantu memperkuat kebijakan dan implementasi penggunaan dana desa untuk bantuan langsung tunai dan meningkatkan data penerima bantuan sosial. Mampu, program pemberdayaan perempuan kami dan peduli, program sosial inklusi kami bekerja sama dengan mitra masyarakat sipilnya untuk memastikan perempuan miskin dan rentan, kelompok minoritas dan populasi rentan lainnya dapat mengakses skema bantuan sosial baru. Prospera, program tata kelola ekonomi, kami mendukung pemerintah dalam merancang dan melaksanakan sejumlah program termasuk program kartu prakerja. Dan siap siaga, program kami yang berfokus pada pengurangan risiko bencana, mendukung satuan tugas penanganan COVID-19 untuk memonitor pelaksanaan berbagai program bantuan sosial pemerintah dan memberikan rekomendasi mengenai potensi sinkronisasi dari skema-skema tersebut. Dan melalui program Knowledge Sector Initiative, kami bekerja sama dengan gugus tugas COVID-19 Bappenas dalam menyediakan real-time analysis yang berkaitan dengan COVID-19 yang dilakukan oleh lembaga-lembaga penelitian kebijakan seperti CSIS dan Semeru untuk memberikan bukti dan rekomendasi kebijakan perlindungan sosial. Dan melalui kemitraan kami dengan JPL Asia Tenggara, sejak berdirinya pada tahun 2013, kami mendukung pengumpulan bukti melalui penelitian yang mendalam dan berkualitas untuk memberikan rekomendasi kebijakan yang relevan kepada pemerintah Indonesia dan pemangkau kepentingan. Kerjasama yang telah terbangun dengan JPL di sektor perlindungan sosial khususnya terus berlanjut selama pandemi ini. JPL berkolaborasi dengan Bappenas dalam melakukan survei nasional kepada 30.000 fasilitator PKH untuk mempelajari dampak COVID-19 pada rumah tangga miskin yang bergantung pada bantuan tunai bersyarat. JPL juga telah melakukan survei online berkala untuk memantau dampak ekonomi Covid-19 terhadap lapangan kerja, kerawanan pangan, migrasi, dan pemanfaatan program pemerintah serta pengetahuan tentang Covid-19 dan protokol kesehatan. Dan JPL mendukung TMP2K dalam melakukan survei pemantauan nasional untuk program sembako. Semua dukungan tersebut merefleksikan komitmen kami saat ini untuk terus mendukung kebijakan dan implementasi program perlindungan sosial yang lebih efektif di Indonesia. Saya ingin menyampaikan terima kasih kepada Kementerian Keuangan. Kementerian Keuangan telah memberikan dukungan, wawasan, dan kepemimpinan yang sangat penting untuk mendorong kerjasama pembangunan yang efektif di antara dua negara Australia dan Indonesia. Saya juga mengucapkan terima kasih kepada tim JPL Asia Tenggara atas upaya mereka untuk berbagi pengetahuan dari studi dan penelitian yang dilakukan dan mengadakan diskusi yang menarik dan penting hari ini. Pemerintah Australia akan terus mendukung pemerintah Indonesia dalam upaya mengembangkan kebijakan dan implementasi program perlindungan sosial dengan pendekatan siklus hidup dan memastikan kelompok-kelompok yang paling rentan, terutama anak-anak, penyandang disabilitas, dan orang tua lansia tidak tertinggal. Kami berharap diskusi ini dapat memberikan beberapa pembelajaran berharga bagi kita semua dalam menanggapi COVID-19, terutama terkait upaya melindungi masyarakat miskin dan rentan dalam situasi yang sulit ini. Terima kasih banyak dan selamat berdiskusi.
Terima kasih banyak kami ucapkan kepada Ibu Kirsten atas sambutannya. Webinar hari ini akan dimoderatori oleh Bapak Dr. Elan Satriawan selaku Kepala Kelompok Kerja Kebijakan Tim Nasional Percepatan Penanggulangan Kemiskinan atau TNP2K. Bapak Elan memberikan rekomendasi kebijakan kepada Wakil Presiden Republik Indonesia serta jajaran kementerian. Beliau memimpin studi evaluasi untuk menghasilkan bukti dan pengetahuan untuk rekomendasi kebijakan pada pemangku kepentingan yang terkait. Bapak Elan memiliki gelar master di bidang ekonomi pembangunan dari the Australian National University Canberra dan meraih gelar doktor dari Michigan State University. Beliau juga merupakan associate professor di Departemen Ilmu Ekonomi Universitas Gadjah Mada dengan spesialisasi penelitian pada bidang mikroekonomi, pengentasan kemiskinan, dan juga health and education economics. Kepada yang terhormat Bapak Dr. Elan Satriawan, saya persilahkan untuk memulai sesi webinar pada hari ini.
Baik, terima kasih Nadia atas perkenalannya. Bapak Ibu semua, Assalamualaikum warahmatullahi wabarakatuh. Selamat sore, salam sejahtera saya ucapkan bagi kita semua. Semoga semuanya dalam keadaan sehat walafiat, terhindar dari bahaya COVID. Pada sore hari ini kita akan mendiskusikan satu topik yang saya kira luar biasa krusial. Kita akan mendiskusikan mengenai topik social protection in the era of COVID. Apa yang kemudian bisa kita pelajari dari bukti-bukti yang ada. Yang saya kira yang hadir pada sore hari ini di Zoom, di ruang Zoom ini, kita semua pernah melewati masa-masa krisis ya. Paling tidak ada dua krisis, yaitu pertama adalah krisis 9. Nah, tetapi apa yang kemudian kita hadapi saat ini mungkin belum pernah kita rasakan sebelumnya, yaitu krisis yang dipicu oleh kesehatan. Ya, krisis yang dipicu oleh bagaimana kemudian infeksi virus COVID membuat ekonomi menjadi melambat, mengalami kontraksi dan bahkan resesi. Nah, Bapak Ibu semua, teman-teman, tidak ada negara yang kemudian tidak dipengaruhi oleh COVID saat ini. Ya. Ekonomi semua negara juga mengalami pelambatan, mengalami kontraksi, ya, dan banyak yang sudah mengalami resesi. Di dalam negeri, di Indonesia, pengumuman oleh BPS pada Juli lalu menunjukkan bahwa pada kuartal pertama tahun ini Indonesia sudah mengalami penurunan pertumbuhan ekonomi, dan pada kuartal kedua ekonomi kita sudah tumbuh secara negatif. Kita menunggu nanti pada kuartal ketiga apa yang akan terjadi. Mungkin masih negatif, tapi harapannya kemudian ada tanda-tanda pemulihan di sana. Nah, yang kemudian tidak kalah penting adalah bagaimana kemudian masyarakat yang kemudian yang merupakan kelompok bawah dipengaruhi oleh COVID. Jadi COVID bukan hanya kemudian mempengaruhi atau melambatkan ekonomi secara makro, tapi juga memberikan efek yang nyata pada seluruh kelompok masyarakat, termasuk kelompok miskin dan rentan. Nah, pemerintah sudah sigap, ya, sejak bulan April, pemerintah telah mengalokasikan resource yang luar biasa besar. Terakhir lewat Perpres 72 tahun 2020 tidak kurang dari 695 triliun dialokasikan oleh pemerintah untuk memulihkan ekonomi, di mana alokasi terbesar digunakan untuk perlindungan sosial. Nah, apakah kemudian strategi ini atau kebijakan ini akan mampu memulihkan ekonomi kita? Tentu kita semua berharap seperti itu. Tetapi efektivitas dari program atau kebijakan tentunya bukan hanya bergantung dari besarnya anggaran, tapi juga pada bagaimana kebijakan tersebut diimplementasikan. Nah, untuk mendiskusikan topik tersebut, saya kira kita memperoleh atau mendapat kehormatan pada sore hari ini dengan kehadiran Bapak Febrio Kacaribu. Beliau adalah Kepala BKF Kementerian Keuangan yang memang menjadi think tank di dalam Kementerian Keuangan dalam merancang kebijakan-kebijakan terkait dengan upaya pemulihan ini. Sebelum saya serahkan waktu dan tempat kepada Bapak Febrio, saya akan membacakan sedikit biodata singkat dari Pak Febrio. Pak Febrio Nathan Kacaribu PhD adalah Kepala Badan Kebijakan Fiscal. Beliau mulai menempati posisi ini di April 2020. Dan sebelum menjadi Kepala BKF, Pak Febrio adalah staf pengajar di Fakultas Ekonomi dan Bisnis Universitas Indonesia. Saya kira juga sampai sekarang beliau masih menjadi staf pengajar, dan juga pernah menjadi Kepala Bidang Kebijakan Makroekonomi dan Sektor Keuangan di LPM UI, jadi Lembaga Penelitian Ekonomi dan Masyarakat di bawah FEB UI. Beliau sebagai peneliti senior di sana. Riset interest beliau meliputi bidang ekonomi keuangan, dan juga masalah kebijakan publik. Beliau memperoleh gelar master di bidang ekonomi internasional dari Australian National University, dan kemudian memperoleh gelar PhD di bidang ekonomi dari University of Kansas. Saya kira tanpa berpanjang lebar lagi, saya berikan waktu 20 menit pada Pak Febrio Kacaribu untuk menyampaikan pokok-pokok pikiran pemerintah mengenai perlindungan sosial di masa COVID ini. Bagi para audiens yang ingin mengajukan pertanyaan bagi Pak Febrio, selama masa presentasi bisa menuliskan pertanyaannya di Q&A box, ya, di salah satu panel di bawah display masing-masing laptop Anda. Waktu dan tempat saya persilahkan kepada Pak Febrio. Silahkan Pak, sekitar 20 menit.
Terima kasih Pak Elan, apa kabar? Udah lama nggak ketemu.
Baik.
Teman semua nih, teman-teman lama ini. Ada Pak Ben, ada Pak Darno juga saya lihat tadi ada di sini. Terima kasih ini untuk kesempatannya bisa ngobrol-ngobrol, saling update. Bapak Ibu sekalian, sebenarnya paparan saya disiapinnya dalam bahasa Inggris, saya juga nggak tahu nih. Mungkin saya jadi kagok kalau paparannya dalam bahasa Inggris lalu ngomong bahasa Indonesia. Tapi kita lihat aja ya, saya sambil dan kita lihat aja gimana. So, ladies and gentlemen, thank you very much for the time. I would like to share about what we've been thinking, what we've been doing from the government side. Go to the next slide, please. So, we are looking at the same thing all over the world. That we don't see any light at the end of the tunnel yet. All over the world, in big countries, small countries, we have big problem from this COVID-19 pandemic. Still escalating in many countries. Epicenters moving from one country to another, especially now big countries with big population. Vaccine still uncertain. Some countries say they're going to be able to provide vaccine starting from first quarter of 2021. Indonesia is definitely, we're trying our best as well, but clearly there are a lot of uncertainties about vaccine. Economic risk, clearly we've been facing a big risk all over the world, including Indonesia. This is what we see in Indonesia at the moment. We have still escalating number of cases. More people getting recovered, that's good news. But clearly in the last several weeks, 2 or 3 weeks, we see that the number of active cases are escalating faster than before. So this is now giving us problems about capacity of our healthcare facilities. Looking at all over the world again, we see that as a result of this pandemic, go to the next slide, please. So we see that all over the world, big or small countries are being affected uniformly in terms of the effect on their economy, but disproportionately in terms of conditions of each countries, of how, in particular, second quarter performance of the economy are vastly varied between one country to another. With Indonesia, for example, with our neighboring countries like Malaysia, the contraction of the GDP growth rate back in second quarter was 17.1%. Philippines, 16.2%. Singapore, 13.2%. Thailand, 12.2%. Vietnam is slightly positive, 0.4%, while Indonesia is at 5.3%. So we are facing the same problems. Each country respond with different strategies, but kind of have a lot of similarities between one country and another. Fiscal wise, all countries respond aggressively, including Indonesia. But of course, it depends on also the fiscal capacity of each country and capacity of borrowing of each country as well. A lot of advanced economies can borrow a lot more. They can afford a lot more, much bigger deficit. For example, like UK, 13.8% of their GDP. Italy, 11.7%. Singapore, 13.5%. US, 17.9%. Indonesia, on the other hand, similar to Malaysia, Thailand, around 6.3%. So, but for Indonesia case itself, we've been building fiscal deficit discipline in the last maybe 10 years that we always keep our deficit below 3%. So going to 6.3 is actually a big jump, but it is also giving us a bit of leeway that we are actually having more fiscal room compared to other countries because we have managed to keep our fiscal discipline for several years until this year. And even in this situation, we believe that fiscal consolidation is going to be very paramount. In the next 3 years, we are allowed to have fiscal deficit beyond 3%, but we committed that by 2023, our fiscal deficit should go back below 3% of GDP again. So we have to face our current challenges this year right in front of us, but we also have to have a medium to long-term view as to how we can have exit strategy from this crisis, not only about health, but also how the economy should be able to exit this crisis in the medium to long term. The logic of our policy is very clear. Like many other countries, we start with the understanding that this is basically the health crisis. And then the first priority of our policies is clearly about handling the health crisis itself. But we also understand that the health crisis itself that is resulting in limited mobility of the people, of course, clearly creating social problems because economic activity is getting disrupted. as a result, the economy is actually becoming disrupted as well. And if we don't be careful about this, clearly there is a risk of creating also a financial crisis as well. So this is the logic that we were following, and we are trying to do our best in each of these node of the logic. We've been following the monitoring and evaluation of our program. So let's go forward to slide number 7. This is what the government is coming up with, the big deficit of 6.3%. We reallocated, we refocused some of our budget items. We grouped them into 6 groups. The first one is clearly for the budget for the health, 87.55 trillion rupiah. And the biggest one among these 6 is actually the social protection program, 203.9 trillion rupiah. Going forward, actually, as it's going now, social protection program is actually one of the best performing programs that we have running day by day, week by week, and hopefully till the end of the year, social protection program, the 203.9 trillion rupiah budget that we have allocated should be able to spend most of those. Actually, to be honest with you, there are actually extra out of this 203. We might go beyond 203 in terms of the realization at the end of the year. I will go next slide. So this is kind of the map that we are looking at. This is not a precise map, clearly, and Pak Elan, Pak Darno, and friends are clearly very familiar with this map. We're looking at the deciles of our population based on income from the lowest to the top. And we are looking at targeting, first and foremost, is the poorest group of our society. So the first decile, the second decile, if you notice, actually getting majority of the programs recipients there. And as we go higher in terms of the decile of these recipients, we see that becoming more and more reaching into the middle income class. And I believe that most of you are following the news as well. The last 2 columns there, these are the 2 last programs. There are 2 things I can mention about this. The first one is that this is reaching mostly to the middle income class. So it's probably not so precise if we color everything until the bottom. I think it should be somewhere above the 3rd decile or up. This is the, for example, the last column there. That is the wage subsidy program for 15.7 million workers. These are formal workers. They are registered at BPJS TK. So we have name and address of the people of these 15.7 million workers. This is a new program. That's the first thing I would like to mention about this. This is a very data-based, name by name and by address kind of program. But the other thing I want to mention is that this is also as a result of evolution of the way we respond to the fact that some of the programs that we have budgeted for the 695 trillion rupiah in the National Economic Recovery Program, not all of them are actually effectively running. So when we realized that some of the programs are not working well, we quickly decided to stop them and then reallocate them with the new programs like this one. So the wage subsidies, this is almost like similar to the payroll subsidy in many countries that have been conducted by several other countries. The second to last column, that's cash assistance for micro enterprises. This is also similar to that, but this is a kind of mix between bansos, i.e. social protection, but also at the same time, since we are targeting micro enterprises, these are tukang sate, tukang soto, etc. So whenever we give them money, 2.4 million per person, we believe that some of them, they're going to be use it to buy clothes, to buy food, but also we believe since they are enterprises, they will also finance their business as well. So these are sort of like a mix between bansos or social protection and helping their businesses, micro businesses at the same time. So looking at the next slide, we are at 36.6% overall of that 695 trillion rupiah budget. We have about 3 months left. We are quite optimistic that we should be able to spend all of them, even beyond 695, because all of these programs actually started back in June, majority of them at least. Majority of these economic recovery programs started back in June. And the first 2 months, June and July, admittedly, government were facing a lot of bottlenecks, a lot of problems about bureaucracy, how to make sure that the program runs well, reaching millions of people, millions of families, but at the same time, making sure that the money is actually received by the intended recipients. So the so-called tata kelola is a very challenging one. And the first 2 months, clearly a big lesson learned for the government. And now since everything is running well, we should be able to spend most of this till the end of the year. And as I mentioned, the social protection program is the one that is running the best out of these 4 out of 6. Next slide, please. So this is the comparison between those programs. For PKH, for example, 78.8%, non-cash food assistance, 70%, and so on and so forth. So we are looking at this day by day. At Ministry of Finance, we have this team of monitoring on evaluation. We have to have a weekly oral exam in front of the Minister of Finance. Every week we have to report to Minister of Finance how everything is going, and we have to make sure that until the end of the year, all of this money is going to be spent effectively. Next, we are clearly, I think I already mentioned some of the problems that we are facing in the field, in the implementation step. Inclusion and exclusion error, clearly, because Pak Elan and friends, clearly you are the nurses who delivered the baby of the TKS back in the beginning. And we understand that that database was built back in several years ago, but we are using that database. Clearly that is not perfect, but that is the best data that we have so far. Clearly, I think we should just go to this next slide, please. Clearly, we need to upgrade that data. We need to come up with better ways of updating the data more carefully. We talked to the Ministry of Social Affairs. We talked to the Parliament. This is a very important data to have and to manage, and hopefully we can come up with a much better quality of the data. We should be able to do that the whole year next year. Before 2022, we would like to make sure that all of our Bansos programs should be based on a very good database that we have. So, and at the same time, we realize that we also have many databases that are not connected with each other. We have to be working hard on making sure that we have a connected databases from one to another. So these are the lessons learned from what we've been doing. And next. Clearly, Professor Suhasil, he's a professor, he's an academician. Febrio Kacaribu is an academician. Bu Sri Mulyani is also an academic. So we are clearly looking at things from the academic perspectives and challenging everybody who are in the government to think about every aspect of our program to be as academically as possible, responsible, and also at the same time making sure that the delivery of our program to be as effective as possible, money that is being budgeted to be received by the intended recipients faster, and also helping their livelihood. So that's conclude my remarks. Again, thank you very much for the time, for the occasion, and happy discussion. And I have to say that we have been benefiting a lot from the work that you guys have been doing at JPAL and also at NP2K clearly, and we would like to see a lot more collaboration down the road with the government. Thank you. Over to you, Pak Elan.
Terima kasih, Pak Febrio. We have about 10 minutes actually for Q&A session. I hope you still have time actually to stay with us to respond to this question, Pak. First question from Ahmad Tohari. Ingat keterbatasan kapasitas fiskal dari pemerintah, kenapa sejak awal bulan Maret atau April pemerintah Indonesia tidak menerapkan micro lockdown ketimbang kebijakan yang seperti dilakukan saat ini? Mungkin satu-satu dulu, Pak.
That is really beyond my purview to answer that. That is a policy beyond Ministry of Finance purview, to be honest with you. But if you look at the comparison that I showed from the very first slides, many countries adopting many different strategies, including the fiscal aggressiveness, how aggressive they are in terms of coming up with the fiscal policies accordingly. I don't think we can actually find a clear pattern as to what is the best strategy in terms of the health strategy, economic strategies, fiscal policies. We're just facing the same big uncertainty that we are trying to deal with. So I think it is, I would like to hear your thought actually as to how do we see the pattern, but maybe right now it's probably not so relevant anymore since we are now in the latest pace of the pandemic, and we are now, like many other countries, like everybody in the world, we are looking at the vaccine, not too risking that putting the vaccine is really at a pedestal, but clearly we don't have any other strategy to handle this pandemic other than the vaccine. At the moment, the best vaccine that we have is everybody wearing masks. And I think that's the best that we can do, and everybody should do that. The 3M, menjaga jarak, mencuci tangan, memakai masker. I really hope that everybody can do that because I think that's the best approach that we can actually handle at this moment. As to lockdown versus lockdown, I really think it's not so relevant, not so productive to talk about that anymore. Many countries come up with different strategies, different results, and many other countries having double-digit contraction in their GDP. We are lucky enough to have 5.3, and hopefully we can be getting better next quarter and the next as well. So appreciate the question, but I think the data shows that it is really hard to find a clear pattern as to what best and what is not to do in this kind of situation.
Thank you, Pak. We move to the second question. Salah satu program social protection untuk pemulihan ini adalah program prakerja, Pak. Dan kita ada kontroversi ya dari program ini di awal peluncurannya. Pandangan dari pemerintah khususnya BKF Kemenku ya, alasan utama kemudian pemerintah atau BKF Kemenku tetap meluncurkan program ini, Pak. Mengingat program ini anggarannya cukup besar, sekitar 20 triliun ya, naik bahkan dari semula yang dianggarkan sekitar 10 triliun.
Well, academically, that is actually one of the best practice in advanced economies dealing with unemployment. So that is like golden rule of how you try to make your labor market as flexible as possible. Because right now, Indonesian labor market is one of the strictest, one of the less flexible labor market in the world. So having unemployment benefit or scheme of unemployment insurance like that, academically, we understand that's the best. And we should start doing that, and we should ask ourselves, why didn't we start that much earlier last several years ago? So that's already settled. Now, the question is actually becoming public policy design question. And we have to admit that, personally me, I think the public policy design is not really the best that we could come up with to start that program. So I think it was also wise to listen to many stakeholders about how the program actually went. And then listening to the stakeholders, the program administrator halted the program for about 2 months, I think. And then now revamped the program again with a much better design. And hopefully with this better policy design, we have much less controversies, and we can really focus on what really matters, what really matters, which is helping people to transition from being fired to getting them ready to go back to labor market again. And hopefully also, if we can do this for 10 million people, that would be really good, that we can start making our labor market much more flexible. And then in the future, this will be a very good starting point for us to start thinking a much bigger agenda about making our labor market becoming much more competitive.
Thank you, Pak. Last question, Pak. From Surita Tunnel, bagaimana pemerintah memastikan dana yang diberikan khususnya untuk dukungan UMKM sampai pada UMKM yang disasar? Karena pemerintah saat ini belum memiliki database UMKM.
Well, that's partially right, partially wrong. We did not have the data until the biggest data that we have. So we started building up the data, and we believe that we had 60 million account numbers. These are from merely from the financial sector only. So we're not talking about outside the financial sector. When we talk about financial sector, we include small, medium enterprises from banks, customer of banks, customer of BPR, right? And also customer of microloans. So we collected all of this data, and we had 60 million account numbers. But again, of course, there are some overlap. Some one or two, or a lot of people probably have different accounts in different places. But I think that's a very good place to start. And now we know when somebody say, oh, how many small, medium enterprises we have? Well, at least 60 million. Because we do have the account number, and we do believe that there are also some micro enterprises that are not listed. They are not really part of that financial sector customer base. So we do have that now. The problem for us now is to clean up the data. And I think this is also a good moment for us, in addition to be honest with you, this is the time to be humble when you are a policymaker, and you realize that you have to work within limitations of especially data. And then we try to work on that for a couple of months. I think the quality of our data is getting much better now. It's not perfect, but again, who's looking for perfectness, right? We start with something that we have, and making sure that we have name and address. And making sure that the intended recipients actually receive the money based on the name and address. Verification process can be really painstakingly happen, but we have to go through that process. So that's going to be the balance between you want to help people as fast as possible, but at the same time you want to be really accountable when you are working on that delivery of the program to the people. But I think I'm not going to be so pessimistic about this. I mean, this is all positive notes to us, because now we realize this year we're facing a lot of challenges, but at the same time, this is also the time that we can actually reform our social protection program. We can reform, the first step is, of course, clearly fixing the data set, making sure that the data is updated much more frequently, and making sure that the mobility of people coming in and coming out of that data should be more transparent and should be more managed much better way.
Well, thank you, Pak Febrio. Actually, we still have some questions, but unfortunately, we're running out of time. So we hope you the best on actually leading the think tank within the MOF, generating actually the policies that will use the evidence from anywhere. And again, thank you, Pak, for being with us, sharing the information as well as your insights on the topics. And again, thank you very much, Pak. Bapak Ibu, now I think it's the time for us to move to the second presentation. We'll present two JPAL affiliated researchers, Professor Ben Olken and Professor Hanna. Both Ben and Rema has been doing research that many of them actually focus on Indonesia, from targeting topics as well as the effectiveness of different social protection programs in Indonesia, as well as the similar topics actually from other countries. So Ben and Rema will share their presentation on the evidence on the programs, the social protection programs, what we can learn actually from the evidence to improve the effectiveness of the programs, of the social programs in the COVID, in the era of the pandemic. Before I hand them actually the mic, so let me read their short bio. Ben Olken is a professor in the Department of Economics at MIT. His research focuses on the political economy of developing countries. He is a director of the JPAL's scientific director of JPAL South Asia, and then co-chair of JPAL Political Economy and Governance Sector. In addition, he is also the co-director developing economics programs at NGER, and board of directors member and fellow at the Bureau of Economic Analysis and Development, BRAD. Ben Olken earned BA with summa cum laude from Mathematics, Ethics, Politics, and Economics from Yale University, and PhD Economics from Harvard University. Hanna is the Jeffrey Chia Professor of Southeast Asia Studies and chair of the International Development Area at the Harvard Kennedy School. She served as a faculty director of the Evidence for Policy Design at Harvard University's Center for International Development, and also as co-scientific director of the Abdul Latif Jamil Poverty Action Lab, Southeast Asia in Indonesia. Her research revolves around improving the provision of public services in developing and emerging nations. Rema holds a PhD in economics from the MIT and BS from Cornell University. So I give the floor to Ben and Rema for the presentation, and the time is 30 minutes. Please, Ben and Rema.
Thank you. Let me just screen. Is that perfect? So thank you everyone for having us here today. We're very humbled to be able to talk today. And I wanted to also thank all of the panelists. I've learned a lot from the discussion, and I hope others have too, and to thank all the participants. We know this is a very particularly challenging time for everybody, and we're just very grateful that you're here to be part of this discussion and to participate in this topic, because we believe it's very important both globally, but also for Indonesia. So today we're going to be talking about social protection in the COVID era. And we'd like to bring in a lot of the evidence from the global setting and also discuss a little bit more about how it's relating to the Indonesia case. So COVID-19 has created an incredible public health challenge. But at the same time, it's also created, as we were discussing earlier, a very unprecedented economic shock with huge consequences for global poverty and also for global inequality. While there's a lot of uncertainty about what's going to happen in terms of the economic situation, I think two key principles are emerging. First is that when the shock first happened, there was a lot of discussion that the COVID shock would happen very quickly and then would recover as a V shape. And I think now many of us believe that this is not, this is a shock that's going to last for a while, and that the recovery is not just going to be as quick to normal levels as before. And this is why government intervention is needed to ensure that there is a smoother recovery. The second aspect of it is that it's not just due to the lockdowns and the government enforced restrictions. There's, as people have lost their job, as people are worried about going to shops and to restaurants and to travel, just the public health crisis itself has led to this economics crisis as well. And so, as we talk about, these trade-offs between, lockdowns and economics versus health, I think it's very important to understand that it's not necessarily a trade-off, but all of these things are intermingled together. Because of this, it's really globally has put a lot of attention on social protection and the need for social protection at a large scale. And a lot of the discussion around social protection globally is that it's not just that we need an increase in social protection, but perhaps we need different forms than we've had before. Expansion of the types of programs, for example, which is what Indonesia has done. And that we also need to be thinking about the fact that different types of people than before might need social protection. So for example, many middle-class households who are not necessarily on social protection might be affected by the crisis. Around the world, 169 countries to date have enacted or expanded social assistance measures. But the one thing to keep in mind, though, is that more is likely needed to be done. If you look at the fiscal stimulus as a share to GDP, it's much lower in low-income and low-middle-income countries as compared to higher-income countries. So, for example, the fiscal stimulus as a share of GDP is about 1.5% in low-income countries. In contrast, in the U.S., where even there most economists believe we haven't done enough, it's about 14%. The other aspect in terms of thinking through this massive social expansion in access and benefits is that, for me, it's really brought home how important these investments in social institutions and systems are in good times. As many countries have had to very rapidly respond to this crisis, they were using the existing institutions in place. And again, some of them better than others. Some of them can be improved further, but these institutions were really the backbone of being able to provide assistance to poor households during this crisis. And so, for example, in Kenya, authorities use their flagship program that supports the elderly, orphans, and other vulnerable members. In Brazil, Bolsa Familia was expanded. In Indonesia, you saw expansions of PKH, Project Sembako, and these institutions are really, really at the heart of being able to provide assistance to the crisis. And this is where the research on how these institutions can be strengthened is particularly important. And so what we want to talk about in today's talk is, as we start thinking about these institutions, both for the time of the crisis, but also as we hopefully emerge to better times, how can we design or redesign these systems and programs to be more flexible and to support the challenges that we're going to be facing over the coming years? And so I should note that, this is, not just a challenge in, developing and emerging economies. As developed countries face key challenges in program financing and program delivery. So, for example, in getting out the fiscal stimulus in the US, there were all these challenges about how the checks were going to be cut, and how do you identify the right people in order to provide social assistance to, how to ensure that the funds were getting into the bank accounts of the right people. And so there were a lot of challenges at place in the program finding, design, and delivery of these programs. But for many emerging economies, they face these challenges plus more. So first of all, there's a more limited fiscal space due to lower tax collection relative to GDP, and bigger challenges to actually borrow. The second one is, given the large informal sector and limited information, how do you actually find the right people to provide social assistance to? And so my colleague Ben Olken will talk a little bit more about targeting in a bit. And the third is, given more incomplete insurance markets, incomplete labor markets, and weaker institutions, how do you actually provide delivery when there might not necessarily be the same digital payments system that you see in a lot of richer countries? And so we'll also discuss this a bit at the end as well. And so in today's talk, while we could, I'm an academic, we could talk for many, many hours, and there are many topics to discuss. But we really want to focus on 4 aspects that we think are incredibly important to highlight in terms of thinking through how can we design social assistance programs better. So the first aspect we're going to talk about financing, and I'll turn it over to my colleague Ben Olken to talk about that. The second aspect, we'll talk about targeting. How do you actually identify the right people who need assistance for social protection? The third is to talk about this idea of conditionality. So for a lot of cash transfer programs worldwide, including in Indonesia with PKH, there's a lot of discussion about how do you design the conditions around the program and whether or not they're still needed in a COVID world. And so we'll discuss that. And then finally, we'll discuss how do you actually think about digital transfers and delivery, particularly in this moment where social distancing measures are needed to be much in place. And as we do the talk, I think the guiding principle in everything that we're thinking about, and the key thing to keep in mind, is that we think this crisis will last, but we also expect it to evolve. And there's a lot of uncertainty about the shape of how it will evolve. And so for thinking through the social protection programs, it's trying to think about how to design them around that uncertainty. How can we make them more flexible and adapt as the economic conditions change around us, both in the crisis, but also in the future as we go through normal upturns and downturns. And so on that note, I'm gonna turn it over to Ben to talk about financing.
Terrific, great. Thanks very much, Rema. Next slide. So I think that one principle that I think we all understand at this point is that this crisis is going to last a long time. There's going to be uncertainty about when a vaccine may arrive, how effective it'll be, whether we'll have herd immunity. And as a result of that, I think we've started to see around the world, countries are are moving in and out of different kinds of different kinds of lockdowns or other types of social distancing regimes. And given that, I think that what we want to suggest is that the governments need to think through how their strategies over the coming 12 to 24 months should be adapted to the evolving public health situation. Okay, and to do that in a way to make the best use of the resources they have available. Next slide. So, and just to reiterate that, I think that we're in a very different position now than we were, say, in the period of April or May, when countries around the world were sort of just experiencing COVID for the first time, and it really imposed various types of hard lockdowns or other kinds of restrictions. Right now, countries have moved away from lockdowns to more kinds of stay-at-home recommendations or social distancing recommendations, or other things like that. But I think, as we've all seen, given how this pandemic is proving very difficult to finally combat, I think there's a lot of uncertainty as to whether or not lockdowns are going to reemerge in the future. We've seen that, for example, in places like Australia, for example, where there was a lot where a lockdown sort of was reimposed, at least in one state or in one city. And I think that that's something that many other countries are going to have experienced. Some other countries have already begun to experience, and I think many other countries are going to be experiencing in the future. And so I think that now is the time when designing these social protection policies to be planning for sort of dynamics that can respond to these things and to potential future changes in the public health situation. Next slide. So the way that we tend to think about it is that the types of social protection programs and the types of transfers that you need depend on what you're doing in response to public health. So when you have kind of the most intensive lockdown periods where you're actually asking everyone to stay home, that creates a need for more universal or broad brush transfers, right? I mean, so lockdowns are costly, they're costly for everyone, but that's particularly true for the poorest of the poor who really live kind of day to day, right? You know, if people don't work on a given day, that means that they don't have food to eat that day. And so as a result of that, if you're asking people to stay home during these really intense lockdown periods, you need to help them survive. And that's both obviously for humanitarian reasons, but it's also essential to get the lockdown policy to work, because we've seen that in countries that haven't provided that kind of social assistance, when you ask people to lock down, but people need to go work in order to get food on the table, those lockdowns are less effective. And so in times of lockdown, you know, we suggest that you should be considering, you know, broad brush transfers, universal transfers, direct food assistance in particular is one nice program because it allows, it provides the most basic needs that people have. It also has a bit of automatic self-targeting, right? You don't need to distribute fancy food, but you can meet people's basic needs during this sort of lockdown period. Next slide. When you emerge from the most intense lockdown period, then you know, targeting of the programs, I think, becomes more important. Of course, you know, as BKF was saying, that while there are substantial funds available, there are limitations in those funds. And, you know, some of the analysis that we've done, for example, in some previous work a few years ago, suggests that with the same level of funds, even with relatively high rates of targeting error, the overall welfare level of the poor is much higher under targeted programs. And that's because, in part, developing countries have less ability to really finely tune or tax back the benefits from universal systems. So basically, if you give out a universal system in a place like the United States or in Europe, you can, it's a universal transfer. Everyone gets the same, say, $1,000, but you can tax back part of what people get further up in the income distribution through the income tax system. In a place like Indonesia, where, you know, the vast majority of the population is not paying any income tax, if you give out a fixed universal transfer to everyone, you know, if you give everyone 600,000 rupiah, everyone gets the same net 600,000 rupiah, because, you know, only sort of the upper middle class and above is paying income tax. That means that universal transfers are less efficient in the developing world than they are in the developed world. And so I think that targeting becomes even more important. Of course, you know, we still worry about exclusion error. And so we'll need to think about additional methods of improving targeting, and that's what I'll talk about in a minute. Next slide. So how do we think about sort of making these programs more flexible? Indonesia actually has some geographically targeted programs. For example, in the BKF presentation, you saw there was a special area for Jabodetabek, which I think was considered, you know, particularly early and heavily hit. But in general, it's actually quite difficult to have an ongoing long-term geographically targeted programs. So next slide. So instead, what we would suggest countries think about, including Indonesia, is making their social protection policies automatically tied to region-specific health metrics or social distancing or lockdown policies. So for example, many countries, like in India, here's a map, you know, has classified its territory into red, green, and yellow zones. In Indonesia, various regions have different, you know, colored zone categories. And the idea is that different phases of the health situation could be automatically linked to different social protection components. So, you know, when a region moves to a red phase and a lockdown is, you know, more heavy social distancing or restrictions are put in place, that could automatically trigger a more generous social protection policy. And there are several advantages of that. One is that Well, first of all, it more directly links the social protection policies with the public health situation. But second of all, it also provides, it cushions the move from one to the other. So there's often a lot of pushback when you move back to a lockdown because of the economic costs, because people, lose their incomes. Having an automatic social protection policy that goes into place when you put in a lockdown cushions that blow, because it says, look, we understand that you're going to have difficult economic situations because of the restrictions, but we're giving you the compensation directly. Likewise, when you remove those social protection restrictions, when you're opening up, you're saying, yes, we're opening up, but and so you can go create more economic activity yourself, and that's a time to make it easier to take away those transfers. So I think that it makes the political economy of responding to the public health situation easier to have these automatic transfers, and it's something we think that countries should be considering in designing their programs moving forward. Next slide. The second thing I want to talk about is the issue of targeting. Next slide. Because this has come up. It's difficult to figure out who should be the right beneficiaries of the programs. And I think, as we've all seen, most countries, including Indonesia, did what they could do in a crisis moment. I think that our colleague from BKF talked about data, and Indonesia had the same situation. Indonesia built off the existing targeting data that was already put in place. Okay, and this is true around the world. And that was the right thing to do in a crisis. But right now, as we're settling into the new normal, we think now is the time to step back and think more about how can we build better targeting systems that are going to be more dynamic and allow us to respond to these kinds of crises moving forward. Next slide. So Indonesia, like many countries, has built a unified database for targeting. And this is actually not a bad idea, it's a good idea. But we need to think about what these databases are doing. What are they capturing well? Who is being systematically excluded? And are the criteria that were used to build universal database systems kind of in the pre-COVID era, are those the right criteria we want now? Next slide. So most universal database systems, including Indonesia's, are based on what are called proxy means tests. So the idea is, in an emerging economy like Indonesia, we can't directly observe what your income is if you're poor or near poor. So we can observe proxies for your income, like what kind of assets you have. But there are two key characteristics of that process. The first is, because they're targeting based on your assets, like observable things that the government, observable assets, like what kind of roof you have, or what kind of floor you have, whether you have a television or a motorbike. That means that proxy means tests are targeting the permanent component of your consumption. Those are long-term decisions that people make. Okay, and that means that proxy means test systems, the errors are going to be systematic. It's going to target people based on long-term poverty. That's going to mean it's going to miss people who experienced recent shocks, people who have no income but still had a nice roof because they were, doing fine before the shock. The second thing is that the data is static. If the goal is to target the permanent component of your consumption, you don't need to update the data very frequently because you're targeting long-run poverty. Of course, for shocks, that's not necessarily what you want. And so these were, I think, the right targeting poverty, so for conditional crash transfer programs like PKH, but they're both uniquely challenging for COVID when we have newly vulnerable and new shock, and people who are more in the middle class who have received shocks. Next slide. So what can you do? So one suggestion is community-based targeting. So we've done a number of studies on these types of issues, including some work on community-based targeting, which we did with many partners of Indonesia, including the World Bank, supported by DFAT, and working with PMK, BPS, Bappenas, Kemensos, and of course TNP2AK. The idea of community-based targeting is to say, look, we're going to give each community a fixed number of slots. And the idea is that can reduce exclusion error. It can allow communities to use their local information to capture recent shocks and adapt to a local understanding of poverty. And in fact, an experiment that we did actually back in 2012 with Vivialitas and many collaborators found that actually beneficiary lists, when we're done with community targeting, better corresponded with local concepts of poverty and much higher levels of community satisfaction. Next slide. So I won't go into the details here, but we measured community satisfaction in a wide variety of ways, and and found that community-based targeting had much higher levels of community satisfaction, precisely because it was able to use kind of local information. Next slide. And actually, let me just say one more thing about community-based targeting. One of the things the government of Indonesia has done in repurposing the Dana Desa to allow the Dana villages to create sort of a direct cash assistance using the Dana Desa fund is exactly taking this idea of community-based targeting and taking it to scale. So I think that that's very much consistent. The idea of doing that is, I think, very much consistent with the evidence that we found that community-based targeting can have a very important role. A second thing that we've worked on is the idea of using on-demand application or self-targeting. And the idea here is you can allow people to apply to be included in beneficiary lists. And so you apply, you then have some verification at the back end, either with proxy means test or matching with employer identification or bank or cell phone records. And the idea here is that when you ask people to apply, you screen out many people who think they're not going to be eligible aren't going to bother to apply. And that can improve targeting compared to an automatic system where you don't have that application step. So again, randomized trials that we did that were published in 2016 showed that having an on-demand step helps improve screening compared to a proxy means test with similar eligibility rules without that application step. And if you look at some of the government programs in Indonesia that are being done now, some of them have similar features. So I know that we talked about some of the controversies about Kartu Prakerja, but one of the things that Kartu Prakerja has is it has an application step. You have to apply to say that yes, we want this program, and there are various kind of eligibility screening in the back end. So people who aren't as in need may not apply. That application step itself has advantages in terms of improving targeting. Next slide. And in fact, our evidence before, if you look at our evidence from before, it suggests that, on-demand application both reduces exclusion error and reduces inclusion error. It reduces exclusion error because people who the government might not have known about make themselves known, and it reduces inclusion error because some of the sort of non-poor don't bother to apply. And so thinking about how can you include those in targeting methods is important for the government moving forward. Next slide. The last thing I'll say about targeting is I think novel sources of data are really important. So I think that in the current crisis, in addition to sort of using asset-based measures like proxy means tests, I think that the government should increasingly build on the fact that it has many different types of data it can use for targeting. There are cell phone data, there's electricity use data, there's bank account data, lists of people laid off through formal industry, and building on the fact that everyone now in Indonesia has an NIK allows the government to link these different data sets and use them for targeting. I think that's an important area to build on moving forward. Next slide. Now Rema, I think Rema will talk about some other program design issues. Next slide.
Thank you, Ben. So Ben talked about one key challenge in the design of social protection, which is how do you find individuals to provide aid to? I'm going to talk about two other aspects that are more about the delivery side. And one of them is whether the delivery side of delivering these programs. And one of them is about whether or not you should require conditionality onto the cash transfers. And the second one is about the payment mechanisms. This is one of the biggest questions we have gotten during the crisis is what to do about conditional cash transfer programs. So conditional cash transfer programs are programs that provide aid to poor households, but condition the aid on what we call good behavior. So it is sending your child to school or and making sure that your child gets vaccinated and goes in for health and nutrition visits. In Indonesia, the large-scale conditional cash transfer program is PKH, which through work with colleagues at TNP Doka and at the World Bank, we've shown has had incredible effects on improving education and reducing stunting in Indonesia. But during the crisis, many countries explicitly loosened the conditionality. And by that, we mean that they were making payments, but no longer requiring the health and education visits in quite the same way. And part of this came with, for two reasons. One of it came with capacity constraints. As these programs expanded to many more people, there weren't necessarily community facilitators on the ground to ensure that people were doing the health and education visits, and that part couldn't be scaled up so quickly. The second part were the education and health supply constraints, that with the current crisis, as schools were shut down, as health centers are being more overrun by COVID, they can't necessarily provide the essential services. And you don't necessarily want to penalize beneficiaries and not give them their full cash transfer payment if they can't, physically meet the conditions because of the social distancing requirements. But you know, even before the crisis, there was a lot of heterogeneity in terms of how the conditions were enforced. Some countries enforce them very strictly. Others are much, much more loose about enforcing them. And we want to raise a provocative idea that that might not necessarily be a bad thing, that the conditions are not very strongly enforced. So first of all, there's some very, very interesting research from Morocco. And to be honest, I think more work needs to be done in this area, where they've did these studies testing if you gave the conditional cash transfers, where you would cut payments if individuals are not attending school, and so you verify them very strictly, versus where you just gave the cash transfer and you tell households this is for investments in the kids, it's for education, but you don't necessarily cut the payment of the household if they don't meet the conditions. And what they actually found was that just even labeling the cash transfers and saying it's for education had similar, if not better, effects than the strict enforcement. And you know, it's much cheaper to do because you don't actually have to go through and verify all the data for all of the households. And so it's just one piece of evidence that's starting to accumulate that this strictness in the conditions is not necessarily necessary to receive the benefits to health and education of kids that we're seeing from these conditional cash transfer programs. I think the second aspect of why we think it's important to have a discussion about the conditions is to try to understand whether or not the conditions could also inadvertently be not necessarily helping the very poorest households you actually want to reach. And so there's this very nice study from Malaria that was done that I think illustrate the trade-offs involved in terms of really enforcing the conditions very harshly and cutting payments if individuals don't meet the health and education requirements, versus just providing a cash transfer to households and not necessarily requiring that they have health and education investments. And so in this study, it was a conditional cash transfer program that was focused on education. And so you got the cash transfer if it was for girls to attend school. And so you got your cash transfer if the girl was enrolled in school and attending school. And if the girl dropped out of school, the family would no longer receive the cash transfer. And so on one hand, in this study, you found some very positive effects of the conditional cash transfer program, that relative to just giving out the cash, regardless of if you attended school or not, it incentivized girls to attend school and it increased test scores. But at the same time, it very much affected the most vulnerable of the girls, those who dropped out. And so if you look at the girls who dropped out, the girls on the UCT, just getting, who were on getting the cash transfer regardless of whether or not they dropped out, were less likely to be married at a very young age relative to the conditional cash transfer program. Now, why is that the case? Well, if you were on the conditional cash transfer program and you dropped out of school, you would no longer be receiving a cash payment. And so then you were particularly vulnerable. But if you were on the unconditional cash transfer program and dropped out of school, you would still receive the cash payment, and that cash payment still lead to better social outcomes, such as delayed marriage and not having a teenage marriage. And so, you know, importantly, this really illustrates the fact that while conditional cash transfer programs have benefits in that they can have incentive effects for the positive aspects of societies, they do have costs, because the very poorest, the most vulnerable, are probably least likely to meet the conditions and are probably more likely than to not receive assistance. And so thinking through these trade-offs are very important in deciding whether or not to enforce the conditions very strongly. Okay. So the second aspect I want to talk about is delivery and digitization. For many of us, the crisis, and particularly the shape of the crisis, which is requiring social distancing, has really reinvigorated this move to digital enrollment into transfer and social protection programs and payment systems. Because we're all very worried about, in terms of trying to provide aid, that you would have a sign-up location or a payment location, and it would get very crowded and you would actually increase spread at the same time you're trying to provide assistance. And so there's been very much this idea that we're going to start thinking about, can we have telephone and web-based services to enroll households in these programs? And can we really think about payment systems that households can use that don't necessarily require going to the post office, for example, to pick up cash?
Rema, if you can finish a bit sooner.
Yes. I can, how much time do I have? Do I have 3
minutes actually?
3 minutes? Okay. So
yeah,
so
Rema, you should probably finish up.
Yep, okay. So why don't I, again, get to the conclusion, unfortunately, that, you know, there's a lot to be done on social protection in terms of the crisis. It's one of the incredibly important tool as we're worried about the, you know, increasing poverty rate that was mentioned by, you know, all of the panelists in this talk, and as we're very worried about inequality. While there's, you know, many aspects of the design of social protection systems that we need to be thinking about, I think we would like to impart 4 key principles to end this talk. The first is that as we're thinking about lockdowns, we do want to be thinking about the fact that we do need to provide transfers to households if you're increasing social distance requirements, both for humanitarian reasons, but also to make the social distancing actually work. The second, and perhaps most importantly, is that we want to be thinking as we move to the future is how we can think about making the targeting of households, how to identify households for social assistance more flexible, so people can move on and off of social assistance when there is a shock, when there is an economic shock. The third is to be very careful about conditionality if the benefits are not large, if they have perverse effects. Because on one hand, conditionality can do a lot of great things to move people towards more health and education, but their costs can outweigh their benefits. And so it's important to reinvigorate that conversation about how strongly should we enforce conditions. And then finally, and even though I didn't get a chance to discuss it as much, that there are huge benefits to the digital technologies, but the design of these programs and the way we structure the programs matter considerably. And these are the institutions and structures that are not going to be there just in the crisis, but are going to outlast the crisis in terms of delivering assistance. And so as we're expanding these digital payment systems, we should really be thinking a lot about the details. And this is something that, you know, we here at JPL are happy to also talk more about later on. So thank you.
Thank you, Rema and Ben for the presentation. I know that Ben has to leave soon, actually. And there's some question that actually put actually chat box for you to answer. I know that you also already typed the answer there, but if you want to, I guess, say some few words on the.
Sure. Maybe I can answer a few of the questions live that I answered in the chat. So there were 3 questions that came up in the chat or in the Q&A that maybe I can talk a little bit about. The first one was a question about the risks of elite targeting elite capture in community-based targeting. And the concern is that if we allow communities to decide who should be the beneficiaries, that they won't give it to the people who are most deserving, they'll give it to the elites. And we've actually done some pretty extensive research on this question. And I think the answer I would sort of some of our findings, and there's more you can read about it. I put the link in the chat and the Q&A. To some of our findings, I think it's true. I think there is a risk of elite capture, but I think it's very small. And it's small for the following reason, which is, first, if you measure it in the data, the additional probability that sort of people who are connected to elites get transfers is actually not that big. You can see it, but it's not that big. The second is there aren't that many people who are connected to elites compared to everybody else. And the third is the people among the elites who are these sort of elite connected people who are getting transfers are not actually that much richer than the beneficiaries, the ones who actually get the transfers. So the welfare implications is like the product of three small numbers: the additional probability that elites get it, the number of elites there are, and how much richer they are than everybody else. And if you add that all up, the total welfare implications of elite capture are really very small compared to the huge gains you get from better targeting through community-based targeting. So yes, I think that it's a potential issue, but as a practical matter, if you actually try to quantify how big a problem this is, it's a small problem compared to the huge benefits that we observe from better targeting. The second question that came up about on-demand targeting is about, is there a risk that sort of the most marginalized people in society are not going to be able to take advantage of this? And maybe they won't know about the programs, or won't be able to apply. And I think obviously that depends on the program. So I think a program that's internet-based, for example, where you have to use a smartphone to apply, that has bigger risks. But in general, in our research, I think our research highlighted a different factor which goes the opposite direction, which I don't think we realized, which is universal or automatic programs. They try to capture everyone and make sure everyone is included, but they miss people too. Nobody's perfect. Government surveyors try to capture everybody in a universal program, but of course, some of the most marginalized people in society live on the fringes of villages or in hard to find places, and they may get missed. Whereas in an on-demand application, those people, if they do hear about the program, can make themselves known. They can come and say, look, I'm here, I want to apply. And in the research that we did on this, we found that second effect actually was more important in the data. So actually we found lower levels of exclusion error for the very, very poor in an on-demand application process than in an automatic enrollment process. So I think that's it. It's a very good question, but at least that's what our empirical evidence suggests. And the third question that came up was, how do we think about UBIs more generally? Do we think those are good? How do we think about those versus targeted transfers? And again, I put a link in the Q&A. Rema and I have written a paper about this. I think our view is that UBIs can be helpful, but I think that, as I was sort of outlining, particularly in emerging economies, they're very, very costly. So if you do a universal transfer, the amount you can give per beneficiary is just much, much smaller than a targeted transfer program. And so as a result of that, I think we think that in most normal times, targeted transfer programs have much higher welfare benefits, much higher welfare implications than universal transfers.
Oke, thank you Ben. Bapak Ibu semua, saya kira kita telah mendengarkan banyak sekali informasi dan insight dari pembicara pertama, yaitu Bapak Febrio Kacaribu, Kepala Badan Kebijakan Fiskal di Kementerian Keuangan, ya, tentang program-program pemulihan ekonomi dan khususnya tentang program perlindungan sosial yang telah dikeluarkan oleh pemerintah, ya, dalam upaya kita mengatasi atau memulihkan ekonomi dari dampak COVID dan menolong masyarakat miskin dan rentan, melindungi kesejahteraan mereka. Dan baru saja kita dengar presentasi dari Profesor Ben Olken dan Profesor Rema Hanna tentang bagaimana evidence yang dikumpulkan dari Indonesia, dari riset-riset mereka di Indonesia maupun juga dari negara lain, ya, termasuk dari peneliti-peneliti JPAL dan peneliti lainnya di banyak negara tentang perlindungan sosial. Apa yang bisa kita ambil dari temuan-temuan riset tersebut, ya, yang bermanfaat bagi kita di Indonesia di dalam mendesain atau meredesain program perlindungan sosial kita. Dari kedua sesi ini kita belajar banyak tentang apa yang sedang kita lalui di tahun 2020 ini. Ada anggaran yang cukup besar, sekitar 700 triliun, ya, dan 203-nya adalah untuk program perlindungan sosial. Tetapi pada saat yang sama tantangannya juga masih cukup besar, dari masalah data, kemudian dari masalah koordinasi, ya, program yang begitu banyak, dan lain sebagainya. Presentasi di sesi kedua oleh Rema dan oleh Ben memberikan paling tidak jawaban-jawaban apa yang bisa kita lakukan lebih baik. Dan ini mungkin hal-hal yang perlu kita perhatikan, ya, hal-hal yang mungkin penting untuk dipikirkan oleh pemerintah, oleh pembuat kebijakan, untuk melakukan hal yang lebih baik di tahun 2021. Ya. Apa yang kemudian program-program seperti apa, program-program perlindungan sosial, program-program perlindungan sosial seperti apa yang kemudian bisa dikeluarkan, ya, bisa dirilis untuk di-launch untuk kemudian secara efektif melindungi masyarakat miskin kita, masyarakat rentan kita dari dampak COVID, tetapi juga dalam membantu pemulihan ekonomi nasional, ya, keluar dari krisis yang disebabkan oleh COVID-19 ini. Saya moderator dari kedua sesi ini, mohon maaf atas segala kekurangan atau ketidaknyamanan dalam memoderatori dua sesi ini, dan mudah-mudahan apa yang kita peroleh dari diskusi ini memberi manfaat bagi kita semua. Saya kembalikan kepada Nadia waktu dan terima kasih.
Baik, terima kasih banyak untuk Bapak Elan Satriawan, Bapak Febrio Kacaribu, Bapak Benjamin Olken, dan Ibu Rema Hanna atas sesi webinar yang luar biasa.